Dopamine D2 receptor. D2 receptor is mostly in the brain. It reduces the release of certain neurotransmitters. It inhibits the indirect pathway of the striatum, which promotes movement. USMLE Question 1. A 30-year-old man is treated with a dopamine antagonist for schizophrenia. He later developed stiffness and tremor. Which receptor is most likely responsible for these side effects? A, D1, B, D2, C, M1, D, beta 1, E, alpha 2. Explanation. Blocking D2 receptors in the nigrostriatal pathway can cause extrapyramidal symptoms, including Parkinson-like side effects, tremor, stiffness. D2 normally helps balance movement by inhibiting the indirect pathway. A, D1, helps start movement, not directly responsible for these side effects. C, M1, involved in memory and secretion, not dopamine-related motor symptoms. D, beta 1, controls heart rate and contractility, unrelated to movement. E, alpha 2, regulates norepinephrine release, not dopamine-related motor effects. USMLE Question 2. Which of the following best describes the role of dopamine D2 receptors in the basal ganglia? A, activates the direct pathway to initiate movement. B, inhibits the release of dopamine from the substantia nigra. C, enhances GABAergic output to the thalamus. D, suppresses the indirect pathway to allow movement. E, stimulates acetylcholine release from interneurons. Correct answer D, suppresses the indirect pathway to allow movement. Explanation. In the striatum, D2 receptors inhibit the indirect pathway, which would normally suppress movement. So D2 activation helps promote movement by removing that inhibition. A, activates the direct pathway to initiate movement. That's the job of D1, not D2. B, inhibits dopamine release. D2 modulates neurotransmitter release, but not its own release this way. C, enhances GABAergic output to the thalamus. Indirect pathway increases GABA to thalamus. D2 reduces this. E, stimulates acetylcholine release. D2 generally reduces neurotransmitter release, including ACH in some pathways.